Hello, hello. Happy Thursday to you. Thank you so much for joining me today. I see my dear friend Brian Schumann on LinkedIn Live. What a treat. I'm so grateful that you are here today. And for those of you joining me on the replay, hello, hello, and welcome to the show. I'm excited to welcome you to today's live Level Up conversation.
Welcome to Level Up with Winnie Sun. Market updates. Award-winning financial pro. Get ready. I present to you Level Up with Winnie Sun.
Happy Thursday to you. And if you're joining, today, I'm going to say, if you're joining me on the replay, I want to say a big hello. I really appreciate when you tune in, even after the show goes live. It makes it so special. But for those of you who are live, we do some really special community moments here. So I don't take that for granted. For those of you who are new to the show, hello, I'm Winnie Sun, your host, Forbes contributor, CNBC council member, and award-winning financial pro. Here to keep you on top of all things trending business news and what makes it so special. What makes our show different is that I'm actually going to be monitoring live comments throughout the show. So don't be shy. Come on in. Let us know how you're doing this week, where you're joining us from, and what's inspiring you today. We love to hear that. Today, I'm just going to tell you is a day I've been looking forward to for some time. In fact, you may have seen me tweet about it earlier today because I have a special guest. He's someone that I've been following his work and his company's work for a little bit here. I'm excited to share the technology and what he's doing with you. He's CEO and co-founder of Sterilray. And for those of you who follow his company already or have heard about this, it could be one of the coolest things I've seen in a very long time, and I'm hoping that you're going to feel the same way. Do not leave. I'm going to tell you, I'm going to encourage you, do not leave me today until the credits roll, because this is technology that you are going to want to know about. It's actually been around for quite a few years, but everyone I've spoken to about it recently has like, how come I've never heard of this? Well, that's why we're here. He started 2 technology startups already and in the golf industry, believe it or not. But this is a company you're going to want to learn about. And most importantly, you're going to wish that you had it at your house, at the office, where you work, every place that you go. Yeah, quite a tease. But let me tell you, it's all for real. Now, let's start with the market and let you know how it closed today. The Dow closed up almost 200 points at 198 points in the positive. The NASDAQ, unfortunately, not so positive, down 178 points, and the S&P 500 down 22 points as well. The Dow Jones Industrial Average did initially surge quite a bit and ended up in positive territory because, well, earlier today I had a call with a good friend of mine from CNBC talking about how the U.S. economy grew faster than expected. We'll take it. The U.S. GDP increased by over 2.6%. We're certainly happy to hear that. But unfortunately, there's still a lot of continuous concerns, but we're hoping this will help give way for reduced inflation. So much to see, much to see. The question, though, is, are we out of the woods yet? Is that the case? Some would suggest not. Unfortunately, we still have sky-high inflation, and the cost of goods is still much too high. For those of you who've been following the show some, you know that the cost of turkey for Thanksgiving this year is up over 70% this year. Crazy times. And there's also geopolitical risk coming from Russia and Ukraine. In fact, one of my clients said, I'm really worried. What if it's going to be World War III? And so I think that's something that many of us have been thinking about. Local businesses are also having to lay off many employees before the year end. That's unfortunately harsh reality. And it's typically layoff season at the end of the year. And we've seen that year after year. And yeah, let's not forget about that pandemic. Oh yeah, I think that's still here, right? Yeah, the pandemic. And of course, the future of long COVID, something that we'll have to account for in the future. And so let's talk about that. How much longer can we afford another pandemic? And is there anything that we can do what we've learned, and how can we prepare for the future? In fact, the CDC, the Centers for Disease Control and Prevention, actually updated its mask guidance earlier this year to note that the disposable N95 or KN95 mask they said that those obviously offer the highest level of protection against virus. But of course, we know not a lot of us still enjoy wearing them. I don't know anybody that really loves wearing them. Some pharmacies even offer to provide them for free for some time, but it seems like that has gone away. I think that was via the US government. But let's face it, PPE is very expensive. In fact, in most cases, it's a $1 for a single disposable mask, $24 for a test kit for COVID is really just not economically sustainable for many households. And during the pandemic, the Shift Project study showed that 3/4 of workers surveyed said that it was very or somewhat difficult to already make ends meet. So, and 40% said that they even couldn't come up with $400 in an event of an emergency. So I think we would agree that something needs to give. We need to figure out alternative ways. We need to get smarter thinking, creative thinking on ways that we can start to plan not only for today's pandemic, but into the future for our children, our grandchildren, and then on and on and on, right? So, however, there is still some good news, of course. Things seem to be getting a little bit better, and there's things to be positive about. But this is also a good chance for us to reflect and figure out what else we can do. And so today's guest is my inspiration for this. Let me tell you, I'm so excited. Mike Olsen. Mike, how are you today?
I'm great, Winnie. Thank you so much for having me, and thank you to your audience for listening in today.
Well, Mike, it is such a treat to have you here. For those of my friends joining us, I want to say a big hello to Sadiq on YouTube Live. I'm seeing Vicky on Facebook Live. I'm seeing Brian Schumann on LinkedIn Live. I'm seeing Joshua CrossX Fighter on YouTube Live. Wow, so many of you joining us today. Definitely do me a favor, send this show out to your friends and your community because this is a show you definitely don't want to miss. Now, Mike Olsen, who we told you earlier, CEO and co-founder of this incredible company, he's actually started 2 other technology startups in the golf industry. And Mike, am I hearing this right? You were a partner in a healthcare software company acquired by who?
Ross Perot, actually, in the late 1990s. Myself and my partners had a software company that we actually became his first acquisition when he formed Perot Systems after having sold EDS to General Motors. So that was an exciting time in all of our lives. And Mr. Perot was quite a gentleman. That's what I can say.
Well, and I think he had good company because you're quite a gentleman. So I've had a chance to get to know you a little bit, Mike, and I have been singing your praises ever since. So welcome so much to the show. Thank you so much for being here with us. Mike, I'm very excited to share with our friends here about your company. This is technology. For those of you who haven't heard about this technology, this is something sort of new to me. I've been doing a lot of research, of course, financial research, and doing financial research is really hard to not also take a look at health research and, of course, COVID information, because we want to prepare our clients and everybody who listens to us into the future. So we want to predict where things are going so that we can provide guidance on how we should best manage our finances as well. Now, the French used UVC technology in 1908 to help eradicate a very scary virus. And I would love, Mike, if you could talk a little bit about that. And then I want to segue over to getting to know you a little bit better.
Sure, absolutely. Well, the French actually used a technology known as ultraviolet light to eradicate the tuberculosis virus in their water system. UVC has been around since the 1870s. It was actually discovered way back then. And then the French actually used it, as I said, to eradicate tuberculosis. And then here in the United States, we've been using UVC for eradicating all sorts of pathogens for a number of years, even putting it in the school systems in the 1940s. It's been a technology that has been known to be effective against not just viruses, but all sorts of pathogens, fungus, mold, you name it. But it does have some drawbacks. And so it operates in a very limited part of the UVC spectrum, and it's produced by lamps that contain mercury. It's not favorable for people to be around UVC while it's operating. And a number of years ago, after I sold my last golf business, I was introduced to 2 brothers here in New Hampshire, in Somersworth, New Hampshire, who the one brother, Ed Neester, is a physicist by way of background, and he actually found that there was another wavelength within the UVC spectrum that was equally, if not more effective, for eradicating pathogens than UVC. And so he set forth to build a very specialized type of lamp that could produce this wavelength at 222 nanometers. And when I was introduced to him at the time, this is going back about 14 years now, it was in its very, very early beginnings in terms of testing and so forth. And quite frankly, we didn't really know how powerful this technology could be. But at the end of the day, we did find that it was actually much more powerful than UVC in terms of actual deactivation of pathogens. But most importantly, it was safe for human exposure. And we know that because we used it on ourselves. We tested ourselves like many entrepreneurs and scientists will do. And we tested it on ourselves, and then we went out for some other additional testing, and we worked with some major universities on the testing as well. And frankly, we were operating as a very, very small venture until the pandemic. And then all of a sudden, after 15 years, we became an overnight success, unfortunately, because of the pandemic.
Yes. So, Mike, I had a chance to talk with you about this before, but I want to talk about also your journey too. How did you come to, your own entrepreneur journey? How did you come to going from golf and then healthcare and then this? Is it something? Are the skill sets the same, or have you learned anything different handling this completely different industry?
Well, great question. I actually have always had an inkling for entrepreneurship. And actually, when I started my career, I worked for a company that was in the healthcare information technology space. And I ended up in that line of work for about 20 years, culminating in the sale of a software company to Ross Perot. Like many others, after that happened, I had my 9/11 moment. I happened to be working at the World Trade Center on behalf of Mr. Perot's company, working with Empire Blue Cross Blue Shield when the towers came down. I was not there that day, fortunately, but many of our employees were, unfortunately. And so at that moment, I just took a look at the fact that I was traveling a lot. I was enjoying my work. I had two sons that were in high school. And I said that maybe there's a better way and a better path in terms of exploring other options. And I did what a lot of people did. I looked at my passion, which one of my passions was golf. And I said, maybe I can combine my passion with navigation. And that's what I did. So I found a technology out of South Africa that actually had been implemented at Wimbledon, tracking the tennis balls during the tournaments. And I approached the gentleman that developed the radar technology. And I asked him if, in fact, he could apply that to a golf ball. And he said, yes, he could. And so we spent a couple of years developing a radar system for indoor golf simulators. The name of the company was About Golf. And it was a radically different and unique approach, but allowed indoor stores, if you will, to sell golf equipment and fit people for golf equipment. So we had a really nice run with that. And I ended up selling my portion of the company to my partners and found another technology in the golf industry that actually was developed by a German MD who had developed an ultrasound system for diagnosing what's called writer's cramp. And that is when you have the uncontrollable shakes. Musicians get it. Some baseball players get it throwing baseballs, and golfers get it too. It's known as the yips. And so what we did is we took that technology and we kind of changed the apparatus a little bit, and we put it on a golf putter, and we were able to track the motion of the putter in 3 dimensions and render that and identify characteristics of the putting stroke as well. And it was, again, avant-garde technology, just a different application of something that had already been used and developed. And we had tremendous success with that. It was that the name of that company was Science in Motion Sports. And so the Sam Putt Lab was used by many of the tour pros, including the greatest of them all. And we had a really nice run with the teaching instructors with that. And then my German MD partner ended up buying my portion of the company out as well after 6 years. So it was at that point I was introduced to John and Ed Neester, Ed being the physicist, and I looked at their technology, having spent so many years in healthcare, and I thought for sure that this technology that could eradicate pathogens literally at the speed of light would instantly take off in the healthcare world. And so we formed a company around the technology to take it to the healthcare space primarily. It didn't take hold. And the reasons are numerous. One of them was the fact that in the healthcare provider space, there are financial incentives at that time not to really deal with infection prevention. I mean, it was given lip service, and because the reimbursement mechanisms were set up in such a way that if you got an infection at a hospital and you had a 20 and still do have a 20% chance of getting an infection, the hospitals were not incented to actually eliminate those infections. And so we were ahead of our time again with this technology, but we did find application before the pandemic for other areas where, pathogens are problematic, such things as hospital clean rooms, cannabis grow operations, believe it or not. vineyards. So we had other avenues, if you will, to pursue with the technology that weren't dependent upon healthcare, and we were successful in that regard. But obviously, when the pandemic hit, boom, everything changed in our world. We had 10,000 inquiries in the first 3 months of 2020. At the point where really we're still following up on some of those inquiries, and we couldn't produce the product at the scale that the market was demanding. And fortunately, we got some good outside counsel, and they suggested that we license our technology to manufacturing companies that could do it. And so we are in the process now. We have 2 license agreements in place, and we're seeking to add additional licensees for those that want to make this very, very special technology and make it their own brand, their own products, and so on and so forth. But in the meantime, we've ramped up our production. For the most part, we satisfied the market demand as it is today. There has been a little bit of a pause, if you will, in people's awareness of COVID. People should be aware that COVID is not going away. It's mutating in ways that we can't expect or won't even know. And it will always be problematic. So whether it's Ebola or SARS or MERS or the next version of COVID, we now have to pay attention to indoor air quality. And that's the one, I would say, good thing that's come out of COVID and the pandemic, is that all of a sudden, people are now paying attention to the quality of the air indoors. And when you spend 90% of your time indoors, that's important. Obviously, the EPA has been addressing water quality. They've been addressing outdoor air quality, pollution, if you will, but they've never addressed indoor air quality. And fortunately, I think they've finally taken notice, and the other federal agencies have as well. So we're going to see indoor air quality improve drastically over the coming years. The building codes will change. There may even be some federal regulations that will allow for that. And so we're hopeful that that we'll be in line with that with our technology.
Very good. Well, Mike, I want to start here.
Mm-hmm.
You know, I think a lot of people haven't heard this term. So I want to start at this level. What is far UV? This is what we're talking about, right? This technology, far UV.
Okay. Yep, that's exactly it. So ultraviolet light is actually a spectrum of different wavelengths. And these wavelengths can range anywhere from, say, 100 nanometers all the way up to about 340, 360 nanometers, depending on whose book you pick up. But within those that spectrum, if you will, there is a range that's called UVC. And that range is a more narrow range of, say, 200 to 280 nanometers. And the different wavelengths within that range, if you will, have different characteristics and different capabilities. But the one wavelength that's been used for over 140 years now is 254 nanometers. And that's what UVC lamps actually produce. They produce 254 nanometer wavelength. And that's a wavelength that we know works for disinfection to some degree. But we also know that's not safe for human exposure. So when Ed started taking a look at this particular range of wavelengths, if you will, his background is actually in the laser business, but he started to take a look at it because he was asked by a local wastewater treatment plant to come in and take a look at their use of UVC for eradicating bacteria in the discharge. So that's how he got his start in the business back in the late 1990s. And so he took a look at this, and he came upon some research that was actually conducted at the University of New Hampshire back in 1934 that looked at all of the different wavelengths within the UVC spectrum. And he surmised at the time, and accurately actually, that there would be other wavelengths that could have equal or even more powerful germicidal capability, but maybe, just maybe, could be safe for human exposure. The problem was, how do you produce these wavelengths? The sun produces all of these wavelengths naturally, but the Earth's ozone layer absorbs them before they hit the Earth. And so where you can get a sunburn from UVA or UVB, you're not going to be exposed to UVC, generally speaking, because of the ozone layer. But he did find a particular type of lamp technology called an excimer lamp technology that could produce distinct wavelengths based on the gas mixtures at hand. And so he actually bought one of these lamps because they were very, very rare, but he bought one from actually Germany, and he brought it in, and then he began to explore, and he produced a wavelength at 207 nanometers first, and then he produced a wavelength at 222 nanometers. And that's how we arrived at the krypton chloride mixture, which is the wavelength that produces 222, or I'm sorry, the gas mixture that produces 222. And he started testing, and he started testing it on different types of pathogens, bacteria, mold, fungus, and even some viruses. And the research that he did in his barn here in New Hampshire led him to file for his first patent in 2005. And that patent was very unique in that it was an apparatus patent for a particular type of lamp, this excimer lamp, but it was also a utility patent. And the utility, which is really, really important here, is the utility to use this wavelength for disinfection. And so since that time, he's been granted 4 continuations on the original patent, an additional 4 patents here in the US, and approximately 10 patents worldwide. But they're all utility patents, and they all speak to using the wavelength for disinfection. So originally, the purpose was to disinfect the air in an HVAC system. And then the patent was expanded to disinfect not just the air, but surfaces, and then liquids. And then most recently this year in February of 2022, we were granted an additional patent for disinfecting human skin, human tissue, and animal tissue. And this, for us, shows unbelievable promise as it relates to wound care and all sorts of treatments. And while we know anecdotally that it can treat skin because we've been using it on our own employees on occasion, but at their request, obviously, but it has just tremendous and worldwide application for solving so many problems and improving the quality of life. But here we have the pandemic at hand. And so a lot of our focus over the last 2 years has been on air disinfection and to a lesser degree, surface disinfection, because we know that, you know, when you have a classroom full of kids and one of those kids has COVID and starts sneezing, that whole classroom is going to get infected within minutes or potentially within minutes. And so we really do have to address the issue of disinfecting the air as much as possible. So a lot of our products, if you go to our website, are going to be oriented towards air disinfection. Certain products are oriented towards, surface disinfection. Yeah, so we have a product that we call the Saber, which actually is used for surface, and there it is right there, is used for surface disinfection. It's light, it weighs 3 pounds. It produces a lot of photon energy. So you can literally hold this about 2 inches above a surface and deactivate COVID at about less than a half a second at a 2-inch height. Very, very powerful technology. But it also gets other pathogens too, whether it be C. diff or MRSA in a hospital setting, or other types of pathogens that may be problematic. Antibiotic resistant pathogens, if you will. So we increase the portfolio of our products based on the application need and what we determine and what the market says to us is the next requirement. And I think we've done a pretty good job of that.
Amazing, Mike. I want to show the audience more of your products. Before I do that, though, I don't know if you saw, for those of you on social, recently, White House COVID-19 response coordinator, Dr. Jha, finally said that COVID is in fact airborne. So this was actually, that was shared in a tweet, and this is his announcement actually saying that, they're actually finally saying that, in fact, COVID is airborne and we need to clean the air. And I know a lot of our audience is watching this and thinking, well, I know that a lot of work needs to be done, but now that I see that, Mike, you've had this technology, you've had it forever, for many, many years now, why don't we have it, like you said, in every hospital, in every school, in every airport? That, I think, is the question that I first asked you when I first met you. I actually thought, is it because it's just so extraordinarily expensive that people can't afford to have this in buildings? And I was surprised to hear that it isn't. So Mike, what is the challenge here?
So the challenge has always been getting from what we would call early adopters to more broad acceptance in the marketplace. And it's probably mostly due to the fact that there wasn't a lot of third-party peer-reviewed research about not just the efficacy of this technology, but the safety of it. Everybody knows that UVC 254 is not safe. And so when people hear that our technology falls within the UVC spectrum, there's a natural assumption to be made that, in fact, it's not safe as well. Fortunately for us, over the last 4 years, there's been a lot of really good work done at Columbia University, Kobe University in Japan, Hiroshima University in Japan, and other universities here in the United States, where they now have published and peer-reviewed research regarding not just the efficacy of this technology, how powerful it really is, but also the safety of it. And so with that research, we're seeing a much more broad adoption. And again, as I said, COVID's not going away. And as people realize that we have to address air quality, I think they're going to turn to this technology more and more. But it's been slow. There's no doubt about it. Frankly, if it weren't for the pandemic, we probably wouldn't be anywhere close to where we are in terms of the progress, not just on our technology, but on the research as well. So now that the research is out there, I think you're going to see. I think you're going to see a lot more adoption.
I love it. Now, I think what we want to do, let's go and show you some of the product, because I think it's really interesting to see. Because as you said, number one is safe on skin, right? On human skin. So, if you're talking, and then you and I have talked about having this in classrooms and high school gyms. I know I even read that Boeing is putting this technology in some planes right now, Mike.
Yeah, they actually, we worked with Boeing back starting in 2015 to develop a set of applications for their laboratories, onboard laboratories. So whether it be the water disinfection coming out of the sink or the air disinfection in the laboratory itself, Boeing is a big believer in this technology. They've prototyped it in their, I don't know what the actual term is, but they have a large plane that they prototype all of their technologies. And they've won several awards for this technology. So they haven't put it on any planes yet. There's still probably a few years off before they do that. There's all sorts of things they have to worry about in terms of equipping planes with new technologies. But they certainly have gravitated towards this as a solution for disinfection. And if there's one thing that's true, it's the air in an airplane is not good quality. We know that. And as much as the airlines will want to dispute that, the fact is it is true. And otherwise they wouldn't be looking at these types of technologies to try and improve their air quality. So we do know that that over the coming years it will be adopted, it will be incorporated. But in the meantime, we have kids in schools, we have very sick people in hospitals, we have commercial buildings that are sitting empty because people don't want to go back to work. We have fast food restaurants where the employees don't feel safe, and where patrons used to go and buy 2 cups of coffee, they buy it at the door and they turn around and leave. So we've got all those challenges ahead of us right now that really can utilize this and make all of our lives much better. And that's really our focus at this point.
It is so important. And that's why I'm so grateful that you spent the time with me today, Mike. I think we need to get the word out about that this technology exists, right? It's made here in the United States. It's capable. It's something that we can start to adopt into offices and hospitals and whatnot. And one thing that I don't think I've actually ever shared this on the show, and I know I shared this with you, Mike, before, is my dad was actually in the hospital for a few years because of an unfortunate accident right before the pandemic. And even before vaccines were out, one of the healthcare workers actually accidentally gave my dad COVID while in the hospital, which created all sorts of ongoing seizures and just a lot of bad things. So this type of technology is absolutely necessary because it takes away some of those difficult discussions of that everybody needs to absolutely mask, because we know that's imperfect, right? Even if you had a classroom full of kids, like my 9-year-old is not going to always remember that the mask has to be perfectly put on. And let's be honest, we don't want our kids to have to mask forever. And it's not just COVID, like you mentioned. There's all these other things that are probably going to come in front of COVID that we haven't even seen yet. So, Mike, what can we do to help with the situation? And what are some of the, I guess, what is the current situation of the problem?
Yeah, so the current situation is that everybody recognizes that the COVID is not going away. It's just going to take different forms. It's going to come and go as the seasons come and go. And in some cases, it may become much like the existing flu situation where we'll have to get an annual shot. But even then, we're not secure. I think that what we really have to do is we have to look at providing a solution that moves away from people's behavior or the reliance on people's behavior, or in some cases their politics, or even some of their financial capabilities, and move to a solution that is agnostic, that actually is there and available for anybody at no charge to them just because they happen to be in a particular facility. And so that's what this technology can do. It can move us away from relying on people's behaviors and attitudes to relying on the technology as part of a building infrastructure and be protecting people even without their knowledge. And once we get to that point, I think you're going to see a dramatic downturn in the incidence rate for not just COVID, but certainly influenza and other types of transmitted pathogens too. And let's not lose sight of the fact that the federal government does have their eye on this. In fact, when the pandemic hit, we thought for sure that they were going to turn our technology, because we hold all the patents and we've been doing it for many, many years, that they would swoop in on our little place in New Hampshire and turn us into the next Manhattan Project. We were actually concerned about that they would look at this technology. Instead, they elected to go a different route. They elected to fund the pharmaceutical companies for vaccinations, again, depending on people's behavior to get a shot. We think that they've now woken up and that they understand that, yes, in fact, we have to look at this technology and other technologies like ours that can be present on and working all the time and protecting people all of the time.
So my people are watching and you're saying, well, I have a HEPA filter at my office, or I've got a HEPA in my child's classroom. How is this different? Does one replace the other? Or what do you say to that?
Well, it's a good question. And where filters are helpful is in removing what we call particulate matter or larger particles in the air. When they're placed in an HVAC system, or even if there's an in-room filtering system, it's helpful, and it needs to be part of the solution overall. We can't just have one technology that we rely on. So that's where it's helpful. The problem, though, is if you solely rely on filters or air cleaning technologies that work with the HVAC system, you're dependent on what's called an air exchange. In most schools, the air exchange is somewhere around 1, at most 2 exchanges per hour. That is, all the air in that classroom is going to get exchanged only once or maybe twice per hour. In hospitals, you might see it go from 4 to 6, in an operating room suite, as much as 10 exchanges per hour. Again, the problem is if you have one sick kid that's in a classroom and he or she starts sneezing, those viral particles are being put all over the classroom literally within seconds. And you don't have the luxury of waiting for an air exchange to protect those other kids. So you need a technology that can work instantly, literally at the speed of light. And that's what the photons that are put out by our lamps do. They work at the speed of light and can protect those kids before, believe it or not, those viral particles can get from one desk to the next. That's how quickly it can work. It works almost instantaneously. So it's just part of a layered solution. And where HVAC is helpful is that HVAC will obviously disinfect the air with our technology at whatever that exchange rate is, but it will do every cubic centimeter within a facility, where it's not feasible, if you will, to put lamps, line of sight lamps, in every room or every space in a school or a commercial building. It's just not feasible. But where you put it where people gather, now you're getting more bang for your buck. So it's just a combination of those things together. And I think we have to really look at multi-approaches or multi-technology approaches to get this and protect people.
Amazing. Well, I hope that you enjoyed. I learned so much from Mike today. I hope you enjoy this, because I think if we can share this discussion, Mike, I think more people just need to know that this technology exists. When I actually got a chance to speak with you, I was like, I can't wait to get my hands on that saber. In fact, do you mind, Mike, sharing what it looks like? Because it's actually really cool.
So this is the saber here. This weighs 3 pounds. It's balanced. And we designed it for surface disinfection, to go over surfaces like this, like my laptop, if you will. But now people are using it. They asked us to design some wall mounts, some door mounts, so they can use it for line of sight as well. As I said before, I'm trying to get it out of my face. As I said before, this can actually disinfect surfaces at less than a fraction of a second, about a half a second of COVID. Other pathogens take longer. But believe it or not, this is what we've used on a couple of our employees that requested to try it for herpes simplex cold sore outbreaks, and it eliminates the cold sore instantly. So we are in the process. We're in the process of forming a medical device company with a number of different versions or applications of the lamp for different disinfection purposes. One of them, obviously, for dermatology. So we're very, very excited about the application for human skin and human tissue.
Well, for anybody out there who's recently had a cold sore, and I have kids, so I'm almost has a fear. Can you imagine having this fix your cold sore just like that? That alone should get you excited. But right, so I know that, Mike, we talked about this too. Like in I said, well, how many of these sort of far UV lights do you need in a classroom? And I think you should share that too. Would be a good start, right? And in a larger gymnasium size, 4 would be a good start. So this is something that is feasible. I think, Mike, is it okay if I share some of the numbers that you shared with me?
Sure, please.
Because I think it was really reasonable, because I think you shared like it was like $9 a day, right, for a classroom.
For a
So
classroom, yeah. If we were to install this technology in your typical 700 or 800 square foot classroom, we would need 2 lamps, and we would finance over the course of, say, 3 years, and that would amount to about $9 per day per classroom, and it would provide for instantaneous speed of light disinfection of anything that's in the air, protect these kids, and the same applies for any other location, whether it be a cafeteria or a gymnasium or a hospital waiting room or ER room. We can offer that same level of protection for roughly the same amount of money. And it's really, really money well spent in our opinion.
it's money well spent. And one of my inspirations of reaching out to you, Mike, was this, is because, as you know, I do a lot of media appearances, whether it be CNBC or the Today Show or Good Day LA. And one of the things that I talk to my friends about who are on air, they say one of the challenges is when you're on air, you can't mask up. You can't protect yourself. And so one of my very good friends who has her own show, who's been filming in person this whole time, has unfortunately had COVID multiple times, and she has a newborn at home, and she just feels like, when is this going to end? So that is what led me to learning more about your technology. And I'm so grateful because it led us to our friendship and getting to know you. But this is exciting. One of the questions that we have that we love to share, it comes from Sadiq and on YouTube Live. And he's asking if your device is foldable. Is this something, I think a lot of us are looking for portability, right? If the buildings don't have this technology quick enough, Mike, is this something that we personally can start to think about for ourselves?
Yeah, the issue there is you need to have enough power in the lamp to offer a large enough protection area that would warrant carrying it around. So while we could develop a 6 or 7 inch high, something that you could carry with you and put in a restaurant table, we could develop that. The proximity of its effectiveness would be only a matter of 2 or 3 or maybe at most 4 feet. So while you have these pathogens emanating from other areas of the restaurant, certainly your table would be protected from everybody sitting at that table, but it wouldn't necessarily protect you from anything else that may be going on around you. So there is a trade-off between the power of the lamp itself and the effectiveness and the range of effectiveness as well. So this is something we just have to work through. We are looking into developing a much smaller profile lamp that would have much more power, that would afford a much larger protection area. In fact, we just came out with a 6-inch lamp for looking at much smaller spaces, including restaurants and so forth. We're getting there. The technology is evolving, and we're getting there, but we're not quite there yet for something that you can carry around. Although I will say that the Sabre has been purchased by hundreds of consumers that are using it and traveling with it and disinfecting their hotel rooms or places that they go, or their luggage. I mean, we have a lot of people that are immunocompromised that really do need to worry about where they go and how they're protected. And so the Sabre is a great solution for them as well. And yeah, we have a lot of different applications: ambulances, Pilates studios, beach volleyball. I mean, there's all sorts of different places that are using this technology right now.
How fun. And I see Vicky Garvey joining us from the UK and saying, hopefully the technology comes to the UK. And let me just say, because I did this research and, and that I know that the Sabre is also high in demand. So it's not like, if you get lucky, maybe you'll be able to get one. So I think that's a good question, Mike. Like, as you develop new technologies, right, a smaller item, where should people go to learn more about the product? Where should they go to follow for more developments?
Yeah, actually, the best place to go is to our website, sterilray.com. And then from there, they can peruse the different applications, the different products, if you will, the science. We put a lot of the science behind the technology on the website itself. And then we also have a presence on Facebook, Twitter, LinkedIn, YouTube, Vimeo. So those sites also, if you look for Sterilray on those social media sites, you'll come across us as well. And we put a lot of interesting kind of fun videos on the application of our technologies and people that actually use it day to day. So it's a good place to go to see how it can be applied.
I would love to see this in hotels too, Mike. I'm just saying, like
Yeah.
airports. I think this would be really great to have, so that you would feel like you're really back to normal and you feel secure and safe that you're gonna be okay. Mike, is there anything else that I didn't ask you that you'd like to share with us?
Well, I would just say to your audience that now that they're aware of the technology, is that spread the word that this does exist and that it is safe. And that, frankly, if they can't remember the details of the technology, just always inquire and ask about air quality. We have to improve the air quality of every facility, every building, everywhere we go. We have to do it. There's nobody that's looking over air quality right now. Nobody's regulating it. Nobody's paying attention to it. And we need more, not just federal intervention, but the local building codes to be brought up to speed to make sure that the air quality in the buildings that we occupy is actually safe. We have to do that.
We have to do that. And I think we would all agree, we want to be safe. We want our children to be safe. So we are the one of the wealthiest nations of the world, and we have the technology. Like, I'm just thinking, let's just hurry up and get this done already so that we can all get on with life, right?
Yeah.
We all miss each other. We all miss doing the things we love. And not only that, for those of you who are like me, who love cruises, don't you wish this was on a cruise ship already? Because come on now, right? Okay, get back to the buffet. But with that, Mike, uh, this has been so fun, but we gotta do speed round because my audiences love this and we want to hear
Sure.
from you. You ready, Mike?
Sure.
Speed round.
All right, Mike, this is the fun part. We get to ask you 2 questions and give you 2 minutes. You ready?
Sure.
Okay. Well, hopefully you'll like these questions, but the first one will be this, Mike. I want to know, what do you think is the best thing that you personally have ever learned, and how has it helped you today?
I think the best thing I've ever learned is to persevere. That you may have an idea that's ahead of its time that people just don't understand, and maybe don't really understand the application of it. And you're going to have to educate people. I call it missionary work. But regardless of the technologies that I've been involved with, they've all been essentially ahead of their time. And we've had to take years to develop not just the product or the technology, but develop the market understanding of how the technology can benefit them. And this particular technology is a really good case in point. I've been working with John and Ed for, well, like I said, 14 years. And we've been at it for 14 years, trying to get this technology out into the marketplace and have people understand how important it is and how it can literally save people and save the planet, potentially, if we have a pandemic that's even worse than what we've been across. So we have to stay steadfast. I will say that Ed and John and I all share a passion for improving humanity and helping humanity with this technology. That's what we're about. That's what motivates us to go to work. And so it's easy for us to persevere with that kind of motivation.
Amazing. I love that. Well, thank you so much. All right. Question number 2, Mike. And this is a special one. We believe here that everyone has their own yes factor.
Mhm.
So, Mike, what would you say that your yes factor is?
Oh, great question. Boy, I would say that if I look back over the years, I have an ability that allows me to take a look at a technology and perhaps see the value of it for other applications. And so whether it was in the healthcare IT industry or in the golf industry, looking at the 2 technologies I was involved with, neither of those technologies had any business being in the golf industry. But I was able to take a look at it and say, yeah, I think there's an application there. And the same thing holds true with this particular technology. In fact, Ed and John and I were so far ahead of our time. We spent 12 years struggling until the pandemic. And so, but we all saw the potential for this technology. And now every day we wake up and we fill a whiteboard with new ideas. So whether it's agriculture or whether it's medical devices or, whatever it may be, HVAC itself, we're waking up and we can't wait to get to work because we've got new ideas that we need to explore and new products that we need to develop and new ways to help people. And that's my yes factor, I guess.
That's your best factor, your genius, your creativity. And we are so thankful to have you, Mike, as a friend to the show. It's been such a treat to get to know you. I hope those of you who are watching will embrace Mike and his company, his technology, and help us share the word because, it's about taking care of one another and sharing is caring. I think this is a great example of that. So it has been my honor to share the stage today with Mike. Definitely give him a follow. We're going to share his information, his company's information out there too. And let me just say, the saber looks so cool. So I'm excited to check it out. I'm actually going to take it up. I'm going to take mine on the road. I'm going to share more of that with you and have some fun. But I want to say a huge thank you, of course, to CrossX Fighter joining us on YouTube Live and Vicky joining us on Facebook Live. And wow, so many on LinkedIn Live. We have a very, very full audience from all different platforms, all different countries. And we appreciate you making the time to be here. Thank you so much for watching, supporting our program. Take a moment to share the show with someone that you care about. Share it on social media, tag me so I can properly thank you on a future show. And as a reminder, you can find full episodes of Level Up with Winnie Sun on NASDAQ, Amazon Fire, Roku, and many other platforms. And don't forget to check out Yes Factor with Winnie Sun, which is part of the LinkedIn Podcast Network on Apple Podcasts or wherever you tune in to podcasts. And with that, thank you so much, Mike. I hope that you have
having me. And thank you to your audience for listening.
Well, thank you for your friendship. We are so grateful to have met you. And let me just say, for those of you who are watching, I know we have a lot of entrepreneurs, we have a lot of media. Wouldn't this be just an amazing gift to a school or a charity or a company, to your employees? This is the stuff that maybe they don't see, but probably they'll be grateful for you for caring to make this happen. I'm excited. I can't wait to bring this into my studio for sure. But with that, take care, be well, and I'll see everyone again next week. Take care now.
Thanks, Winnie.
Bye.